Hello, welcome to Headwaters Healthcare Center, located in Orangeville. My name is Annette Jones. I'm the Vice President of Patient Experience and Chief Nursing Executive. Today, we wanted to share with you some good news and some new information about our Clinical Priority Plan. What is our Clinical Priority Plan? It is a 5-year roadmap that helps us to identify where we need to grow as an organization to best meet the needs of the community. It also helps us to identify where we can improve to get even better. Headwaters is committed to high quality care to our patients together with our community partners. The Clinical Priority Plan is also embedded and helps shape our strategic plan as an organization. So why are we doing a clinical priority plan? Most hospitals, for example, do prepare a clinical priority plan, and that's because we want to better understand key statistics of our community, including the trends of where our community is growing and the needs of the Dufferin County and the Caledon area. As a piece of information that might be of interest to you, our population right now in 2021 tells us that we serve the Dufferin County and Caledon area, and that population sits around 143,000 people. And what's expected, as we looked at our clinical priority plan, it's expected that by the year 2041, our population will almost double to be at 266,000 residents in our community. The review of our clinical programs and services really does help us to define where we need to grow and areas for improvement for our organization. The information that we have gathered from trends and statistics about the health of our community also helps us to shape the physical infrastructure of the building and where we need to grow in our physical building. Who is the Clinical Priority Plan for? The plan is designed and is really for our community by our community. And so the Clinical Priority Program gives our staff, our leadership, and our community a 5-year roadmap of where we need to grow and areas for improvement.
Hi, my name is Dr. Grace Wang, and I'm the Chief of Staff and Vice President of Medical Affairs at Headwaters. I'm here to tell you a bit more about our Clinical Priorities Plan. So to help us develop our plan, we sent out surveys and held several small group focus sessions. We heard from over 1,000 staff, patients, volunteers, community members, and partners. We looked at our current programs and services, the activity and performance to help us better understand where we have been, our current state, as well as where we need to be in the future to help support our community. As mentioned earlier, Headwaters and our community is one of the fastest growing populations in the province. And to give you an example of the activity that Headwaters saw last year, we had over 38,000 emergency room visits. We performed over 76,000 diagnostic imaging procedures, over 5,000 surgeries, and delivered over 900 babies. These numbers will only increase as our population increases. The intent and purpose of the CPP is to highlight and identify key areas we need to focus on in order to support the growth and expansion for the clinical programs. Through the CPP, we identified 5 key areas, including emergency services, mental health, geriatric services, pediatrics, and obstetrics. So behind me, you'll see the entrance to our emergency department. Our emergency department is currently running at full capacity. We know that our current physical space is not large enough to support the volumes that we see. We are currently in the process of updating the hospital-wide master plan, which will address this issue. In the meantime, our teams are looking at ways to optimize our current space and resources so that we can decrease patient wait times and improve patient flow through the department. We will be looking to see where we can expand our services and to enhance our partnerships to reduce visits to the emergency room, as well as provide necessary supports to reduce repeat visits to the emergency room. Here we are in the ambulatory care unit. This is where we see many of our outpatients throughout the year. For geriatrics, we know that we need to increase the services that are unique to this population. Residents that are over the age of 65 are one of the highest growing populations in our community. We just onboarded a new physician who has an expertise in geriatric medicine and will be working closely with our geriatrics nurse to develop a more comprehensive program that will provide the necessary supports that we need. Mental health and substance use support is another key area we need to focus on. Over the past 4 years, mental health visits and transfers have increased by over 43%. It is no secret that demand for this specialized area of care is increasing. We need the right infrastructure to be able to support our patients, including proper staff training and education, development of interprofessional teams, as well as dedicated safe spaces for patients in our emergency room and on our inpatient units. We also need to increase crisis support and enhance our community partnerships. Here we are in the obstetrical unit at Headwaters. Our obstetrical program was identified as one of the key areas needing improvement and expansion. Last year, we delivered over 920 babies, but that represents less than half of the women in our community who need obstetrical care. We recently completed a comprehensive review which highlighted areas to which we can make improvements. Our teams are working hard to make the necessary changes and improvements that will strengthen and expand the quality of care we can provide to patients. Here we are on our pediatric floor, as you can see by the beautiful hand-painted murals on the walls. Our pediatric program has undergone significant changes over the past few years. Much like our geriatric population, the pediatric population is fast growing. We know that there are many complexities that are unique to pediatric care, different from adult medicine. I am very pleased to share that we have a group of enthusiastic physicians that are committed to making changes to develop and enhance our programs. While I went through 5 of the key areas identified in the Clinical Priorities Plan, there are many other projects on the go around the hospital. Each department is looking for opportunities to expand and improve their programs, including the Diagnostic Imaging Department as well as the Department of Surgery. This is a very busy and exciting time for all of us here at Headwaters. I, for one, am super excited for the work to come in the coming few years that will lead to enhanced patient care and quality care close to home.
Other main findings from our clinical priority planning work is that we also know, in addition to the 5 clinical priorities that we identified, we also know that we need to identify and work on 4 key areas for all our clinical programs. And that is referred to as a quadruple aim. And the quadruple aim identifies 4 key areas for all our programs. One is the patient experience, the second is the staff experience, the third is looking at population health, and the 4th is ensuring that we have value for money. And so what I'd like to do is walk you through each of those 4 areas in a very high level. So starting with the patient experience, for us as an organization, the patient experience is really a key part of what we want to focus on as an organization, because that's really important for every person who walks through our building. It means we want to ensure that we're providing quality service, excellent communication with all our team members, and ensuring that the patient is at the center and the core of everything that we do. The second is around the staff experience and ensuring that we improve and we're working on the experience of our staff, physician, and volunteers. Ensuring that we have diverse teams, that we provide team-based care, but also we want to ensure that we provide the training and education so that we have highly skilled, highly qualified staff and physicians who work here to deliver best practices and the highest quality of care to everyone. And in that way, we build, we recruit, and we retain a very strong workforce. The third area of the quadruple aim is around population health. So we want to make sure, as part of this plan, is that we're looking at how we serve diverse communities, how we serve those who have accessibility needs, and really important for us to ensure that we're addressing the needs of those underserviced populations. We also want to advocate for those who have unique needs in our community. And finally, the fourth element of the quadruple aim is around maximizing our resources and ensuring and improving efficiencies. So what this means for us is that we want to maximize digital opportunities. That includes virtual care. We also want to make sure that we are fiscally responsible as an organization. In closing, I'd like to provide some summary remarks. First and foremost, Headwaters is a partner in our community to serve your healthcare needs. And I'd like to take this opportunity to thank everyone who provided input into this clinical priority plan, who helped shape the plan, because your input is important to us. At Headwaters, the future is exciting and it's bright. And if you'd like to learn more about this clinical priority program, please visit our website at headwatershealth.ca. Thank you.